I am excited to introduce and present Ekene Nkem-Mmekam.
I am so happy to be here right now. This is like the culmination of multiple years of hard work from the parts of so many people in this room that you're looking around at right now. So thank you all for being here. Thank you all for sharing this moment with us. I want to tell you about a problem that I've been really diving into in the last 4 months. I want to tell you about how I want to go about solving it, right? So my name is Ekene Nkem-Mmekam. I'm a Nigerian immigrant. My family came over here. My family came over here to the States when we were 4. My mom didn't have much money at all. So we were basically poor, but my mom cared about education. And as a result, I was able to kind of climb through the ranks a little bit, get educated, and ultimately, go to a good school and do all the things. I became a software engineer, building out front ends and microservices for companies like Citrix, Square, Stripe. I was last on the beaches of Brazil, enjoying that digital nomad life, but something felt missing. Like, I can't really explain it, but it felt like I was letting down what I really wanted to do with my life, and that is basically use the power of technology to help the people that I feel like are usually left behind, right? So I learned about the Journey Ventures, talked to Justin, talked to Mark, and learned, this is what I need to be doing, right? And so when I learned about these tough challenges facing us in healthcare, I didn't say, let me run away. I was like, this sweet. Let me run towards these challenges because this is for my people. This is my community. And so one of the problems that we were learning about is the fact that in Medicaid, we have a lot of imbalances in terms of where someone lives. Their zip code completely changes the outcomes and the determinants that determine their health, right? So we'll have 2 people in completely different zip codes, and because of the way they've grown up, their financial situation, their health outcomes will be completely different. So I want to tell you the story of 2 women here. Both of these women have bipolar disorder. They live in the same area, but they have completely different outcomes. Meet Kayla, 35 years old, struggling with bipolar disorder for over a year, but she's middle income. As a result, she can access transportation to and from her therapist and afford her medication. As a result, she sees a reduction in symptoms. Now meet Jasmine, same age, same diagnosis. However, she's low income. She cannot afford transportation to and from her therapist, and she cannot afford her medication. As a result, she's hospitalized with suicidal ideation. Now, Jasmine's case is not rare at all. Factors like your socioeconomic factors like education, finances, and genetics make up more than 80% of what determines your healthcare outcomes. And Jasmine's insurers know this, so they spend millions of dollars with programs like delivering free food to the home, putting people in Motel 6s around here in Arizona because they understand that you need a house over your head to make sure that you actually receive that health care. They're also giving transportation to and from clinics for people that can't afford transportation. So what we have here is an imbalance or a disconnect, right? We have people like Jasmine on one side that have a need, and then we have insurers here that understand that there's a need, but don't have the engagement or haven't had the relationship to connect people with the resources they're spending millions of dollars to provide. And insurers aren't doing this out of the goodness of their own hearts, right? Avoidable hospitalizations cost them about $4.4 billion a year. So they're seeing this as a cost-saving measure. If I pay more, if I pay now to get you to and from the clinic, I'll pay less in a few years in saving on hospitalizations. That's why we've created Joiful Health. It's a digital care management platform that partners with insurers to connect Medicaid patients to preventative care and social services. At its most simple, we save insurers millions in avoidable hospital costs by using SMS technology to connect patients to existing preventative health and social service benefits. This is something that I love to do, connecting people to resources with the power of technology. At Momentum, when I was in college, I started a company called Momentum where we connected female entrepreneurs in the developing world to the resources they needed to start their own small businesses. 4 people that I've never met, actually, 4 college kids raised over $40,000 completely organically and funded women in Uganda, Kenya, Colombia, Venezuela. At Sweet Relief, I connected low-income New Yorkers to public restrooms. I was pounding the pavement, asking restaurants one by one to list their restrooms on my platform. You can see how that turned out. Joyful Health. Now, it was very difficult. Now I'm connecting low-income patients to preventative health and social services. I've learned a lot throughout this process, and I think we're on to something here. Now, what are we doing? I think a lot of people ask me, like, with these low-income individuals, do they have phones? Do they have access to internet? Our surveys reveal that an overwhelming majority of our population has a smartphone. Not only that, through Obamacare, they actually have access to smartphones as well. So that's not the problem. 80% of the population as well has almost constant access to internet. The question is, how do they like to be contacted? In our surveys, it revealed that they rather be texted than called or download an app. So that's where we're going that way. So basically, we're taking a bunch of data, personalizing in a way that really makes sense, and providing them answers to questions that they might be having. So that's what we're doing. So we're partnering with resources like Find Help, 211, United Way to have people understand what are the social services around me. Where is that food pantry? Where is that homeless shelter? What are the income assistance programs that exist for me? Actually, also understanding, well, what does my plan provide? What can I get connected to that I'm not already connected to? And taking that information and providing it in a way that works for them when they need it on demand. And also connecting them in particularly difficult situations with a live care manager at the insurer's facility that can actually get them through more difficult situations as well. The market's huge, $16 billion Medicaid care management market, $69 million in Arizona alone. And why now? As the rise of value-based care, as people start getting paid for their outcomes on how they can reduce their healthcare costs, we're going to see more payers, more payviders and managed care organizations. The AI revolution has made data that is now readily available more concise and making us able to personalize it in a way that really makes sense for the user. And we're seeing a market gap here, and this is where we really want to target. So 5% of patients make up about 50% of the spending in Medicaid. As a result, all of the funding tends to flow that way. However, there's a less costly 10% that makes up about 30% of the spending, but they don't get that same support. As a result, the 5% is the most costly, the most sick, and receives the most amount of money to administer care. However, a lot of this care is typically intensive, in person. But however, this 10% receives about a fifth of the same amount of money to administer care to them. They're very costly, very sick, but insurers don't have the same kind of resources to give this kind of care to them. They need something that's scalable, technological friendly, that they can offer these people before this 10% becomes the 5% and their costs increase. I'd put our competitors in kind of 2 boxes here. We have the people that'll come to your home and they're really in person and they'll kind of get rid of some of these barriers to care, but it's not scalable and it's incredibly expensive. Then we have people that are high tech, low touch. They're not getting rid of some of these barriers to care and it's not really personalized. We're melding some of the best of these things, right? Scalable, high tech, and also addressing some of these barriers to care, plugging in the Uber Health APIs to make sure that if you need a ride, we can schedule you one in an automated and quick fashion. Who are our target customers? Simply put, our customers get paid at a per member per month rate. Managed care organizations, we can save money for them. Accountable care organizations, not only can we help them save money, in some cases with a behavioral health provider, we can help them make more money tying into existing billing codes. This informs our business model. Assuming 20,000 members at a rate of $1 a month, we'd be at about $240,000 in revenue. Now, insurers typically have anywhere from $1 to $7 in care management spend billed out. So we need to tap into this and make sure that we're providing value for them. What's our goal? What's our forecast? Starting off in year one with a $50,000 design pilot, getting into that $240,000 revenue number, and then a leapfrog into this $1.4 million revenue number as we serve only 80,000 of the 2.4 million Medicaid patients in the state of Arizona alone. We can hit this number with just one customer. Not saying we will, but we could hit this number with just one customer. Your average Medicaid insurer will have somewhere between 100 and 300,000 people under their care. And we're building for the future. We're starting off as an engagement tool, engaging members to connect them with resources, building out into a platform on a per member per month and a SaaS billing model, expanding care manager and case manager capacity, and also selling to ACOs. Then we're going to move into a healthcare and social care OS, connecting governments, healthcare systems, and private sector to make systemic change for our members and as well as the government. And we're moving pretty quickly. What have we been doing? We've been on the ground, serving over 250 low-income patients, meeting with the nonprofit leaders that are in charge of providing these systems for them, meeting with the case managers, the care managers, to understand what is their day-to-day actually looking like. We've partnered with Valley Hospital to make our patient surveys part of their discharge planning. I'm still not sure how we did that. We got about 40 to 50 responses there, really understanding and partnering with an organization to understand what are their needs as a hospital, but also what are the needs of their patients there as well. We've been in early pilot conversations with NARBA, second conversations with Banner Health, and we're building a prototype right now as we speak. We're asking for $400,000 for 12 to 16 months financing. This money is going to go to three things: launching our first design pilot, building out an MVP, and reaching that 240,000 ARR number by Q3 2025. What are we going to do with the money? A lot of that's going to flow into technology, making sure that we can actually service that design pilot, build out that MVP, and get out into the streets. I don't want you guys to think, seeing this 75% technology number, that we're just going to be in a dark basement like coding. This money is basically flowing into giving us the ability to hit the streets, understand people's needs, come back, iterate quickly. I don't want 3 to 4 month cycles where we just build out a platform without getting feedback. We're talking about like 3-week sprints as opposed to 3-month sprints. That's our team. You've heard about me a little bit. I think some of that funding is going to go into changing my headshot. I think I need a new one. It's from like 2 years ago. I think, and also building with the Journey Venture Studio, a group of leading healthcare executives, business leaders, and behavioral health practitioners. They've really helped me open some of these doors, make some of these connections, understand the problem, and dive deep into the solution. I have one question. Will you join the Joyful movement? Join me creating a world in which we can actually connect low-income patients to the care and need they actually deserve, and that exists. Thank you so much, guys. I appreciate you.